Now I'm going to start over the thymus. The thymus is the main part for the maturation of T cells. And it's located anterior superior to the mediastinum, and it is the site of T cell differentiation and maturation. And it's encapsulated. The main question, the main fact about the thymus is that the thymus epithelium is derived from third pharyngeal pouch from the endoderm. But the thymic lymphocytes are going to derive from mesoderm. That is the amazing fact about the thymus. The thymus epithelium is derived from the endoderm, third pharyngeal pouch, and the thymic lymphocyte having mesodermal origin. It is also having some parts like cortex and the medulla. In the cortex, they then with the immature T cell, and medulla is paired with mature T cells. Like for example, that is the cortex and this is the medulla. The cortex, they are immature T cells, and in the medulla there is a mature T cells giving the pale look, and the hazard corpuscles containing the epithelial reticular cells. The normal neonatal thymus is giving a cell shaped on the chest X-ray, like that. The normal neonatal thymus is giving the cell shaped on chest X-ray, and it's involuted by the H3 hairs. And guys, in some condition, they are having immunodeficiency and hypoplastic thymus in the children due to DiGeorge Syndrome. You already know this is the 22q11.2 deletion syndrome, and C is SCID, that is a severe combined immunodeficiency. And you already know that T cell is maturing in thymus and B cell in bone marrow. And what is a Thymoma? Thymoma is a neoplasm of thymus, and it is associated with Myasthenia gravis, superior vena cava syndrome, pure aplasia, decrease in RBC production, and a good syndrome, the good syndrome. You already guys know it is a Thymoma associated with hypogammaglobulinemia. Hypogammaglobulinemia. That is a good syndrome if a Thymoma is associated with hypogammaglobulinemia. This is all about the thymus, and main thing, fact is the thymus epithelium is derived from endoderm, and the lymphocytes are going to derive from mesoderm.